Hello, Jim Howard here in Fort Worth, Texas. Today's date, it's June 30th of 2021. It's almost 3 p.m. here. I want to talk about medication errors. Um, I have a very poor memory. I haven't made any. I haven't made any serious medication errors that I can remember. I'm trying to think back. Medication errors can be really, bad news. Uh, I worked at a hospital. Well, I worked at a lot of hospitals, hospital security for 30 years. Actually, worked a bit longer than that because then I ended up in Orlando, Florida, and I ended up working at a hospital there. That was contract security. The 30 years in Kansas City, Missouri was in-house security. Security actually worked, you know, as an employee of the hospital. And we did a lot. And I'm not going to go into all that. I've mentioned some of, we were hazmat responders at the hospital. Now, of course, if it was, something serious, then, we would have called the fire department for, hazmat, and for them to handle the situation. Uh, I can remember one time we had a car pull into our new parking garage, and it drove up on something, and it tore open its gas tank, and a lot of gasoline spilled out. And the way there was construction, the bottom part of this multi-level parking garage, there was the receiving dock area in there and that type of stuff, and it was going to in there. And so, of course, fire department responded to take care of that, and we just made our report on that. My ex-wife, uh, we share this apartment with my grown son. I'll be mentioning my grown son in a little bit because he had a medication error today. Um, my ex-wife, let's see, what did she have? What was the problem that she was in the hospital for a while? And then she wasn't able to come home. So she was transferred over to, I forget now what they call it. Hospitals used to, you go in the hospital and you go in the hospital, I guess, to have a baby, and I can't remember how long what was like normal. But I know I've heard things about women talking about that they, enjoyed having a week in the hospital when they had a baby, that it was, especially I guess back in the older days when women had a lot of, a lot of kids. I was an only child, but when I was a kid, the neighborhood that I lived in, I was about the only, well, there was, I know in the same block that I was on, there was one family that had a only child, and him and I were friends. But I think all of the other houses, they were like multiple, but now times have changed. Times have changed too. On now, I think woman goes in and be lucky if they don't send her home that afternoon after she has a baby or something. They've really. Uh, Let me stop at this point. There's a reason for that, and I'll come back to it. Okay, I'm back. I'm using Manicam again, for at least for this video. I can't remember now if this is going to be automatically joined with the clip that I just made, or whether it's going to overwrite it or what. So I may repeat myself a little bit just to make sure. Medication errors. Anyway, my ex-wife went into the hospital. I think this was for cancer. And then she needed some, you know, it used to be you go in the hospital and they would keep you, but then the insurance cost, you know, came in, and then the insurance companies, they have a code for every, I mean, the code book is like this thick, or maybe thicker. That might just be one of the volumes. And if you go in for whatever you go in for, there's a number, a code that, and insurance companies have decided, or, well, I think the insurance companies are the deciding factor, but the hospitals, well, the insurance companies here in the United States, if you go in for a gallbladder problem, let's say they expect, you know, and you have to have your gallbladder taken out or something, they have a time, let's say 3 days. The insurance company says, you know, we'll pay for 3 days. Now, if you have some type of a complication, I don't know. If for some reason something happens and you're in there for a week, the insurance company may say, we're not paying. We only pay for 3 days. Also, I mean, there's just so many different areas of this. Hospitals would, you know, some patients would have to be kept, you know, age, you know. I mean, maybe if somebody breaks their leg, you know, that could be a, you know, they could break their leg and have an operation done and go home then that day or the next day. But sometimes, you know, no, hey, got to be in tractions, all types of things. Has to be people. A person breaks a hip or something, has a hip replacement. You're in there for, you know, a longer period of time. Then you have to go for, you know, rehabilitation to get you using. There's all types of things. There's a code for every one of it in insurance companies. And why did I get on the subject of coding? Well, anyway, I think I had a reason. Anyway, my son used to take a medication each day. And the problem with that is he would forget, or maybe even sometime he might have not remembered whether he took it for that day, and he might have taken it, you know, twice or something like that. But then also there was times when he just decided not to take his medication. That happens. I did a YouTube video a while back. I'll put the link to this. Oops, and it's, let's see here. Okay, there we go. These things that are sitting on this tray here, they're not, you know, they're not part of it. It's these things up here. If I tip this, stuff's all going to fall. Maybe I can tip it a little bit. Has a date on it, on each of these. 31 of them, because of 31 days in a week. This is one of my more popular, I think, YouTube videos. This is the, you know, one of these. This is for the first of them. Then there's 4 compartments: morning, noon, evening, and night. you know, and they open up, and then when it's red, of course, that means that, you know, it's empty, it's been taken or whatever. Here's the one for today. Today's the 30th, and I took my morning medication, but my evening medication is in there. Now I still sometimes I make a mistake and I, you know, forget. But so I'll put a link to this. Okay, stuff is falling here. I reviewed it, and I liked the product. I still like the product. I'm still, actually, this is a second one, because the first one I used, and then when my son was not taking his medicine, I tried to get him to use it, and he didn't want to use it. And then it ended up that my ex-wife used it for very small things that she put in here that she sold on. She stored them in there, and then she took them out when she, you know, would send them or whatever. Can't even remember what it was. She was selling something on eBay. So she ended up using this and losing, you know, several of the containers. So later I purchased another one of these. Let me switch, maybe, nope, not that one, this one. And I'm still using this one, but you know, it is a pain. Like I was doing 31 days filling it with medication, and there's a possibility for, you know, an error if you end up, you know, somehow, like when I had them in rolls, and I would be, you know, one for, you know, the this, and then or like on the thing for morning and night, sometimes I would forget to put the one in for the night, and just, you can still have problems. But so anyway, what I found was, man, it's a pain in the butt to do it for the entire month. 31 of those. If you have, well, I guess I'm not gonna. I got a container filled with medication, you know. So so what I started doing again, and then for a long time, what I did is I would just do like 8 days at a time, one roll, you know. And but then it seemed like I was just having to get the medicines out and, you know, filling them up. And so I've gone back to doing an entire month at a time. Turns out right now, the way I've arranged things, that I have a bunch of desk space. So now about medication errors, the Mayo Clinic has a thing here about medication errors. I'll put a link to it. They talk about what are medication errors, how do medication errors happen. Medication errors can happen to anyone in any place, including your own home, the doctor's office, hospitals, pharmacies, senior living facilities. It kids are especially at high risk for medication errors because they typically need different drug doses than adults. Knowing what you're up against can help you play it safe. The most common causes of medication errors are poor communication between your doctors, poor communications between you and your doctors, drug names that sound alike and medications that look alike. And I've noticed that with the medications I'm getting, there's, I don't even know which ones they are, but there's two medications that are, white rounds. Let's see, where is it? Which camera are we on? Nope, we're on this camera here. Can you see these two the white pills in there? They're almost identical in size. Now, of course, they have something different, inscribed on them, but things like that. Medical abbreviations. Here's the thing, know how to prevent medication errors. My ex-wife, when she had cancer, and then she had to go to I forget what they call them now, because the hospital, or the insurance company, would not let her remain in the hospital. She had to be transferred to a separate facility. I think some federal regulations were involved in this, or state regulations, to try to hold down Medicare or Medicaid or insurance and the cost of things. So like I said, I worked 30 years hospital security. No matter what government regulations or state regulations, no matter what is put in or was put into place to hold down hospital costs, hospitals find a way to get around that. And that's like, okay, you can't, insurance company says you can't keep a patient for this medical problem longer than X number of days in the hospital. Well, the person needs some medical, okay, well, you can't keep them in the hospital because of the tremendous cost of the hospital, but they can be put in another facility that is, not the hospital. I think the hospital's probably tried moving them to another floor, moving them to another hospital, right next to it, the same hospital, but try that. Has to be a separate facility. I don't know what the rules that he came up with. No matter what the rules are, hospitals are going to get around those rules. So they came up with a separate facility. And this, that's where, she ended up. Now, of course, what happens is the hospital, which is non-profit, and they set up a corporation, which is profit, and it's their corporation, and you would not believe. It was so easy in the beginning when I started working hospital security. You had the hospital, you had a hospital administrator and 2 or 3 assistant administrators, and that was it. Years later, first, second, third hospital I worked at, by that time, they had set up, they had the hospital, which they had, and then they had set up a corporation. I'm not sure they set up a corporation. And of course, the corporation headquarters were in another building right there at, on the hospital property. I'm sure, though, that in some legal work or whatever, they probably they probably designated that, property as not being hospital. Who knows what shenanigans they pulled. But it used to be when I worked at the first and the second hospital. I'd say I was patrolling, and somebody would flag me down, or maybe I was patrolling on foot or something. Somebody'd say, "I'm here for I'm looking for human resources," the employment office, or they would say, "I'm here to see the CEO," or something like that. For the third hospital, it became, let's say it's human resources, like hiring. I'm here for, I'm looking for, okay, are you looking for the human resources department for a research medical center? Or are you looking for the human resources department for Health Midwest, the corporation, I mean, it just gets, and that's the same with, the cost of scans, CAT scans and all these other types of scans. Oh, that's so expensive. So hospitals set up, separate facility that's for dialysis treatments, where your blood is liver problems or whatever, and your blood is taken out and run through this machine and goes back in you, and you spend hours every day, hooked up, not at home. Maybe they could do some at home. I don't know. I don't think so. And so, you have the hospital. They used to do it in the hospital. Now they have a medical building next to it, or across town, or something owned by, and people go there by their own car, or go there by, some type of medical, or, bus. They show up, in a bus, like a school bus, and unload every day, go in for their treatment. It's just, insane. Anyway, my ex-wife was sent over to she had been in for cancer, and then she needed to go to a separate facility. She went over there, and a separate facility was not as bad as a nursing home. I don't know about what situation is like in other countries, but nursing homes over here, they pay very little money, and they pay so little money, a nurse or a nurse's aide or whatever, they don't really want to work, they don't really want to work there. I'm talking about, let's say a good, good nurse, a well-trained nurse and whatever. So they pay so little that you pay for what you pay for what you get. And so then I'm 80 years old. Something could happen. I could be next month, a year from now, or 2 years from now, whatever. I could be in a nursing home. And I'm sure there are nursing homes that have very high standards, and that the employees are, but I think those are few and far between, and something should be done to make sure that all of the nursing homes, we're all, I don't know, maybe there are some people who are wealthy and Republicans who think, well, I don't have to worry about that. I'm gonna, I won't end up in a nursing home. But you don't know. I knew a guy. He had an electrical contracting business. He made good money. He had electricians working for him, union people that worked for him, and he made a lot of money. He was very arrogant, and very arrogant. and thought he was above everybody else, better than everybody else, and that these other people, they were, and he and his family, they started out, poor in life, and he worked up, to have a successful business, but then he got old, and he ended up, in a nursing home, and on top of that, and I'm not sure exactly how that works. The system also here in the United States is set up, and I don't understand the details of it too much. I did a video sort of on that, but he had some resources, and those resources should have been used instead of the government, paying for him being in a nursing home. Those resources should have been used up first, and then the government should have kicked in. But the government kicked in right away, and I don't know how that happened. But so he was one of those people that he despised and thought were beneath him, and he was being taken care of by people who, I guess they had to have the minimum wage, but that was about it. And if you're old, if you're any age, but if you're old and you want somebody taking care of you who's making more than minimum wage. You want somebody who they didn't pick, just anybody who walked through the door. So, and we can all, be in that position. And if you're one of these assholes that think I'm better than everybody else, and I've seen cases of, I'm not going to go into it again, but I had a situation where a guy was an elderly gentleman, was out and about. He was heading to the bank, and he had $6,000 in $100 bills heading to the bank to put into his safety deposit box, and he had some type of a medical condition. He ended up in the emergency room. I got called at that point at that hospital. Security did not pick up valuables. Well, we did if somebody was, but that the business office would pick it up. But in this case, the business office didn't want to handle, So I went down and counted it out with the gentleman, and sealed it up and everything, and locked it up. And about a week or two later, I got a call to call sort of like this hospital social worker, I believe it was, and she said, could you do us a favor? Could you, this man is been in the hospital for 2 weeks or whatever it was, and he needs to go to a nursing home, and he has $6,000, and could you take him to the nursing home and take the $6,000, and give it to the nursing home? And I said, can I come over to the office and talk to you? And I went over and I said, hey, I remember when this gentleman came in, and I'm the one who picked up the money and everything. And I said, he was on his way. I said, why don't you let me take him so that he can put it in his safety deposit box? That's what he wanted to. No. At first that would have been okay, but the nursing home found out that he had $6,000, and they have to, there was a situation of they had to use that for, and they said and I said, well then cancel it. you know, find another nursing home. Don't tell them about the $6,000, and you know, uh, oh no, no, it can't be done. So I had to take him over to the nursing home, and he was, I mean, distinguished looking gentleman and whatever. And so I handed over the money to, I can't say what I want to say at this point because you would say that I'm prejudiced or, whatever, but when I handed it over to this guy, I just knew as soon as I left the office, this guy was going to put it in his pocket. He made $6,000, and he was going to put down that the gentleman didn't, and the government would be paying, for X amount of time. Also, I went with the guy up to, he was depressed. I went with the guy up to, and it was like a ward. It was like cots. It's been, I forget, maybe 8 in that room or whatever. And this guy, just, I didn't hear any, but tears were running down, his cheeks and everything, and I had to leave him there and, go back to the hospital. Something needs to be done about the entire system, but it's not going to happen with our current political situation. With the way Congress is, I don't know what the solution is to those kind of problems. Unions would help, and paying people more than the minimum wage, paying them a living wage, and there are other things that I think could be done, but I don't know. We have churches here that are nonprofit, or they don't pay. Now, I've known some Protestant ministers who, in fact, I worked with a guy who, more than one. I worked with a guy who, his name was Sam, real nice guy, and he'd been to Bible college and wherever they get their degree, and he left the hospital and went out as a pastor, but they were small, small congregations, so small. Now those people you don't want to tax. In fact, those people you want to, you don't want to give them money, or everybody would say they were a minister. But he came back after a couple years being a pastor or a minister, and then he told the church that he was sent to, I don't know, had maybe 10 families or 15 families. Now, luckily, they were large families, a whole bunch of kids or whatever. But not enough for the pastor was living in a house where the cold air came through, and Sam came back to work as a hospital security officer. But I don't know how you can legislate this, but one, just tax these mega churches and Catholic churches that take in tons of money and own real estate and own businesses, not religious, businesses. They own, all types of, tax them. Now, maybe if you're taxing businesses at, let's say you tax businesses at 30% rate, you know, and of course Amazon doesn't pay taxes and Google doesn't pay, they don't pay taxes. They know how to get around that. But let's say you're taxing them at 30%. Okay, well, these churches and maybe hospitals don't tax them at 30%. Tax them at 10% or something. But maybe what you could do, like, was, let's take nursing homes. I'm really off the subject, aren't I? Because there's so much. Maybe what you could do is, there's a lot of churches. Maybe what you could do is, let's take nursing homes. Maybe what you could do is schools, Boy Scouts, Girl Scouts, I don't know what, schools, you know, have the children who go to the school, and of course you have to make sure that, you know, the children are protected, and, you know, you don't want to send them into a nursing home where they're going to get, you know, but, I mean, those things would have to be worked out. All this would have to be worked out, and it's not going to work out ever because, but require, okay, you're the Belton Baptist Church. Okay, there's, you know, a couple schools in your area, and some of those, a lot of those are probably, you know, their parents, you know, probably go to your church because you're right there in that neighborhood. Come up with programs or whatever where those kids do something as part of their schooling. I mean, you're not going to send them over there every day, you know. Not going to send, but maybe once a week, and it would have to be the same kids, you know. You could be, maybe even once a month, you know, this group of kids, group red, the red group or whatever. Maybe they go to the nursing home, and the nursing home then can say, you know, okay, well, here's how you can help out. Is that okay? You know, you want to do this? Would you like to sit with Mr. Jones and just, you know, talk to him and let him talk, you know, talk to you, or, you know, I mean, they could work out a plan, and then of course refine it as you find out that there's a problem with it. So do that with churches, and then you know, don't tax them. Or maybe if they are being, if we decided to tax them, which I don't think is going to happen, let's say that it's decided that they're going to pay 15% taxes, and just the ones who actually are making, you know, money. If they're not making money, you know, you'd like to help the ones that aren't, that are just struggling. But I think we could, that would be a problem with our system of government and our constitution, you know, of giving money to religious groups. Which ones are you going to give it, you know, give the money to? So I don't think that would work out. But maybe you could do, maybe if there's a 15% tax on these wealthy churches, maybe, okay, if you do this, I think you ought to say you will do it, you know, then maybe you could say, okay, well, you don't have to pay on your taxes, you know, you fill in this information, and you don't have to pay 15% in taxes, you only have to pay 10%, or whatever, you know, figure out you only pay 10%, because your parishioners are going out and going into the nurse, and if they were going to the nursing homes, then too, you'd have, you know, not just kids, but you'd have some adults who volunteered for certain things, and they'd be going in, and they could be like, you know, eyes looking around, you know, hey, you know, this, this isn't right. It needs to be, taken care of. Back to my ex-wife, and she went over to this facility, and uh, now there again, I don't know, and I think it probably varies by state. I'm not sure. I know in hospitals it used to be, and I'm not sure what the situation is now, that of course a registered nurse had to be the one who, put the medicines in the containers. Or, well, pharmacy would, like, it depends, it varies, would send it up, packaged up or whatever. But the RN would be the one who would have to, okay, Mr. Jones is, okay, he's getting this, if it came up with pharmacy, it would probably have Mr. Jones's name and number and the whole bit, and you check to make sure and ask if, what's your name when you're, do all this kind of, whatever the rules are. So, but then I think they've gotten, I don't know, I think they've gotten it where now like a licensed practical nurse can take the medication and give it to the patient. And I'm not sure, I think it may have gotten now where you don't have to be an RN or a LPN, you can be a pharmacy technician, or, something, I don't know. I know that when I was working at, I can't remember which hospital, the hospital, I guess, had done a study and to figure out how much, because I was on a couple study groups, whatever, not on that one, but there was like, how much time does the nursing people spend on the medication part? The nurses are charting all the time. They have to chart everything, which is good. They do need to do that. They have to chart everything. A lot of them get carpal tunnel syndrome from, and but they came up with, wow, the hospital, oh wow, such a large amount of time that the RN or the LPN spends in taking the medicine, and giving it to the, sometimes, of course, medicines have to go, and they, have to be injectable sometimes. Sometimes they go into your IV thing. I mean, there's tremendous, well, sometimes medications are radiation. Sometimes the radiation thing is put into somebody, and then they have to put a sign up on the door, radiation do not enter, have to make sure that the radioactive material is recovered, taken out in whatever it's supposed to be taken out, or that if the patient expires, dies, or whatever, that radioactive material is taken, and hospitals have radiation detectors. When you take trash down or laundry down, because sometimes the radioactive pellet or whatever it is ends up in the laundry, and they have to have radiation detectors to, whoops, wait a minute. And I remember one time, I wasn't working that day, but I heard about it when I came back the next day. Somehow a radioactive pellet had come out of somebody, hadn't been recovered. I don't think they knew it was even not recovered, and got sent down, and somehow it went into the, the people who were taking care of the trash or whatever, would go through certain doors, going into where the stuff would go in. I think that was probably the, you have to use these because there was a radiation detectors, somehow the radiation detector wasn't set off, because I have a feeling probably somebody, who knows what happened, they have maybe trash bags on it, maybe one of the bags fell off. Oh, wait a minute, somebody went in and pushed the cart in, and then said, oh, that bag fell off, and maybe that person went in through another door with the bag. Oh, this fell, who knows, I don't remember. But the trash truck, it has to be special trash trucks, or maybe not special truck, but uh, it costs a lot of money for bio waste or radioactive waste, a lot of money to be spent. I forget what it was per pound, a lot of money. And there was several times I had to, inform like nursing staff or whatever. No, you can't throw a pizza, pizza box does not go into the biohazard, thing there. Because it cost, I forget, $14 a pound or whatever it was. I had a nurse that was ER nurse, and she was I'd worked with her at the main hospital, and then I was working with her at this other hospital that we went, and she was know-it-all, arrogant, in every way, and I had to nicely, say, oh, by the way, don't put the pizza box in the biohazard thing, and she said, oh yeah, we can do it. I said, no, you can't do that. And I knew, I said, it costs $14 a pound or something if you put that kind of stuff in there. So I said, now I'm leaving it in there because there was, biohazard material, blood and other things in there, and it's in there now. I'm not taking it out, but don't put any more in there. And she says, I forget what she said now, it's been a long time, 10 years. She said, you're wrong and I can do what, and whatever. So it was very rare for me to write up an employee for something like that. I wrote her up and she heard from administration or whatever, don't be throwing, So how did I get onto that subject? I do not know. And I do not know how I will put key words in this. Talking about, make. Of course, then you're going to get into, with religion, you're going to get into, the government can't tell us that we have to, God is our supreme, Lord and Master, and the government can't tell religion what to do. You're not telling them that, here's the prayer you say. You're not telling them, that you'd be telling them if you want benefits from the government, then help out. Let's improve the quality of these nursing homes and other facilities, maybe, like that. I don't think I told you, I think I jumped ahead. Yeah, okay, I didn't. So my ex-wife was at this, she'd been in the hospital, went over to this, other facility. And I forget what they called them. It wasn't a step-down facility. But she was there, and now I don't know, because anyway, the medical person comes in. She thinks it was a nurse's aide bringing her her medication. Maybe it was. I don't know what. At that time, I don't know what the rules were. And said, "Here's your medication." And Darlene said, I only take 2 or 3 medications in there. I mean, I don't remember the details, There's like 8 there. And the person said, the doctor wants you to take those. And so she's, okay. And then she took them. And then a little bit later, the person came in. Did you, and of course they're supposed to, I think, watch, see if you take them. She came back and said, did you take that medicine? Well, yeah. Okay, well, that wasn't your medicine. That was somebody else's medicine. Somebody else just got your medicine. And I guess that person probably said, I don't take these. And I guess the person probably said, well, the doctor went. Well, no, I'm not. And so then that's how that came out. Nothing bad happened to you know, my ex-wife, she didn't drop over, she didn't have, you know, whatever, but you've got to watch those kind of things. Anyway, the hospital I was working at, that did the study, they came up with, they were going to, they wanted to, they had to get permission. They wanted to train employees, you know, hire people and give them training, and then they would be medication technicians or something rather, and that would keep the RNs not having to do it, and I guess the LPNs would not have to be doing it or something like that. But this was in Missouri. If I remember correctly, the nurses in their registry of whatever, you know, the group that nurses have to be certified through. They have to show that they've had the education and the training, that kind of stuff, and then they get their RN's license from the state, or LPN license from the state, or like when I got my EMT license from the state, you had to meet certain standards. The nurses in Missouri, their association, said, no, this is not, we're not allowing it, we're not standing for it, and you can't do it. So now probably the hospitals eventually got around it some, because they always find a way to get around things. So I worked at a hospital, and when I went out to it, it was a small hospital. I went out to it, and there was a male RN, and at that time, which was crazy, he worked with not an LPN, but she was a paramedic. Now, it'd be fine to have a paramedic, or, well, like I had to spend time, you know, volunteering in the emergency room to get experience in order to be, you know, certified as an EMT. Paramedics would have to spend more time, that type of stuff. But no, she was an employee, and she was working there, and the hospital thought it was fine to have an RN and her. Now, eventually, they didn't hire any more in, and eventually she was like gone, and then they had LPNs, RN and LPN. And then eventually I continued working that place long enough to see where, no, have to have 2 RNs. But anyway, when I went there, this guy, and he had been in the military as a medic, and then when he got out of the military, he was a paramedic on an ambulance. And then I don't know what, you know, his credentials, you know, sounded pretty good. But anyway, so we're working together at this small hospital. Well, we weren't working together. He was, and he had no previous, well, maybe he probably had previous hospital experience. He didn't seem to understand that, you know, and at night, so he was the RN at that small hospital. At night, he was in charge of the hospital. You know, if something came up, he was the one, you know, that, and that's fine. I mean, I can understand. I worked years later with this security officer, and this was the first hospital that this security officer had worked at. In fact, I think he'd been like a reserve police officer or something. He was not too knowledgeable about anything. And so he would, you know, he would tell me, well, that, and especially, of course, it bothered him. By that point, there wasn't a, you know, the nurse in the emergency room at night, and that's when we worked, you know, we worked at night, only one of us at a time, but he was like, well, we should be the one in charge. No, the way that all the hospitals are set up, Monday through Friday, there's the hospital administrators, assistant administrators, there's department heads for all these things, and I said, but, at night when they go home and on Saturdays and Sundays, the director of nursing, whoever's holding that position, usually she, is, that's the one. And it bothered me sometimes, like, one time I came in to go to work, because we didn't have a security officer there during the daytime. I came in at 10 p.m. at night. It was the worst night I've ever seen. I come in, there was a helicopter there, there was like, normally there'd be 1 or 2 ambulances. There was like 5 ambulances there. I came in, and Virginia, the nurse, elderly nurse, she'd worked at a lot of hospitals. Thank God, Jim, you're here. I need your help so bad and everything. And then right after that, the fire alarm went off. And I was pretty sure that the fumes from the helicopter had shut it off. But anyway, Virginia, Jim, ignore it. I need your help. Ignore it. We're too busy for that. And I just said, okay. But then I had to take care of, she said ignore it, but, I had to go unlock doors so the fire department, when they showed up, could get in those doors. And I needed to unlock the door to the plant operation department so I could see on the panel where, the fire was being indicated by the alarm. I needed to silence the alarm because the alarm at that time, the hospital had put in like an industrial, alarms or speakers or whatever they used to generate it, that the sound was that you couldn't even hear, because I guess when they were designing the hospital, somebody said, oh, well, you need really loud ones. Well, let's get the alarms that people put into factories when they're, building things that make tremendous amount of, instead of putting in what they needed. And that needed to be, silenced. And then I had to do all these things at the same time without any help. Then I needed to go to the scene of the fire and see if, what was going on. And I figured it was, okay, so I started to tell you about this guy. That was the male RN in the emergency room, and he just thought that he was, so he told me something. I said, that's not right. And then yes, it is, I said, no. And it was like God was trying to, or, some genie or whatever. He said something, and I said, no, you can't, you can't do that. And I forget what the issue was. And he says, yes, I know, I'm in charge, Oh, I hate that when somebody says, all those years of working hospital security, sometimes I would have a nurse or something she'd be saying, yeah, Jim, the security here, they work for me. I would never, when I had people who were working for me, I was like a security supervisor on the second shift for years. And when I went to go on, I wanted to go back to the day shift and, IUB. When I was put in to go to the day shift, the guys that I was working with, they were like over in, and I was there with them, over in the emergency room, and they said, we're going to be getting a new supervisor. And the nurses there, the ER nurses, we didn't know you had a supervisor. Yeah, Jim's our sergeant or whatever it was. You know, he's our supervisor. We didn't know that. That's because I didn't go around telling people. I handled things, and I did things, a lot of things, but I never advertised. You know, I never advertised it. And in general, I was able to deal with people and not have to, not have to do, not have to do that. I remember there was at that hospital, the midnight shift supervisor, security supervisor, had been there for years, and nobody liked him. I actually got along. I was able to get along with just about everybody, but he was hard to get along with. But I got along with him. We were friends. But there's a couple times that he went off on me. But on the midnight shift, the hospital, of course, we locked it up before they got there at 9 o'clock. They came on at 11, I think, or whatever. But then when they got there, we turned the keys over to them. And it turned out that we would hand the keys over to them. One set of, one of us had the master set of keys, and when they came on duty, then we gave them the keys. Come to find out, they would just take the keys and throw them down on the outpatient desk there, and just leave them laying on the desk. And then sometimes, often, most of the time, they'd walk away from that desk, leave the keys there. He especially messed with the nursing and people so much that they took those keys. That's how I sort of found out about it. They would first they took the keys and just, then when in the morning when, Lloyd was looking for the keys, and then they'd say, we got him, and they'd give, you shouldn't leave him laying there, And then he was like, I do what I wanted, And then they started they turned him over to the, security director when he came in. And so, anyway, when I found out that this was going on, I told the second shift security people, I said, okay, when the other shift comes on duty, make sure you give them the keys, and don't let them tell you to put the keys down, leave them on the desk or whatever. Make sure you hand the keys to them. I said, if you have a problem, come to me. Right away, that night, when the next shift come on, and we were, and the security officer went and said, here's the keys, just put them on the desk. And of course, at that time, the security was standing outside. There was nobody at the desk, that desk, because they're outside watching the employees as they come and go. So, and the security officer said, well, Jim says, no, just put them on the desk. So he comes and tells me, so I said, give me the keys. And I went over and I said, here, you need to take the keys. No, Jim, just put them on the desk. And I said, whatever his name was, I forget. I said, this pisses me off a big, a lot, because I almost never, ever have to order somebody to do something. They just do what needs to be done. And I said, you're making me give you an order, and I'm giving you an order right now. You take these keys, and you take them every night from us. What you do after, we leave, I don't care. Of course, I did care. But you take the keys. And I said, if you have a problem with that, you can just go time out and go home, because you're going to be fired. Now, do you want to take the keys, or do you want to be fired? They took the keys after that. But, yeah. So I talked about my ex-wife. They gave her the wrong medication. Okay, that guy I was telling you about. at the hospital that was so arrogant and had been in the military and had been an ambulance, a paramedic, and then he became an RN, and he just, oh yeah, I was going to tell you, I forget it was, he said, what was it? I can't remember now exactly the, oh, I think I told him, that working in the main hospital, and this guy, his girlfriend, I think this is what I told him, his girlfriend pulled in a big fancy car, and she was driving. The guy was drunk. He was bleeding. He was in the passenger seat. She gets out of the car. He locks the door. She goes back. She hits the button, unlocks the door, starts around. He locks the door. So I go over and I said, sir, you're bleeding. You need to see, no, I don't want to. And she's, saying, oh, he needs to see the doctor. He's bleeding. And I said, well, in my opinion, he's been drinking, but he knows what he wants and what he's doing. And I said, so well, what am I doing? She was like, I said, you need to just leave. Take him and go. And she said, I can't believe this and whatever. And I said, well, here's the solution. Just drive across the street and sit over there. When he loses enough blood that he passes out, then you can bring him on over here and we can treat him. And she said, I can't believe it. And she left, So I don't know the exact details, but, and I had a new officer that I was orientating that was with me. And he had no previous experience. He was actually from a Bible college. At that point, the director of security at that place, he wanted people that he hired me by mistake. Like I mentioned him before, he must have had 2 envelopes in his drawer. One, do not ever hire this guy, and then the other one, hire this people or whatever. And I think he opened the wrong envelope and hired me. Because I think I was on the list, never hire. But anyway, so I was orientating this new officer. And so we're heading down the hall, and here comes the director of nurses. This was, of course, at night. And I said, I forget her name, let's say Betty. I said, oh, Betty. And I explained it, and she said, that's great. You handled it perfectly. Thank you very much. So anyway, that was at this other small hospital then, and then I told this guy this story somehow, probably with better clarity than I'm telling you now. And he says, oh no, you can't do that. You can't turn somebody away. You can't blah, 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 going on with that bullshit, And I said, well, you're wrong. There was this hospital, it had just opened, and it was a small hospital. And a car pulls in at high rate of speed, pulls into our ER garage. They opened the door, there was like 4 guys in there. They opened the door, and the beer cans fall out into the, which would be an open container, you could be arrested for that. And probably the driver was, DWI too. Anyway, so this guy, the RN there, he goes out with me, And anyway, the guy who was bleeding got out of the car, went around the corner, outside, because the garage doors were up. He went around outside. I went out, got him to, I didn't drag him back or anything, come on back. And he wanted to come back anyway because that's where his buddies were. So he comes on back. And he didn't want to be treated, of course. Of course, his situation was, I guess the same, wasn't it? He didn't want to be treated. And that RN just, the guy just tried, oh, you need to be, and then he said, well, okay, wait a minute, and he went in and got some 4x4s. He's like, he's like, here's some 4x4s, hold that on the thing or whatever. And then they left. And so, and we had a little conversation. I said, that's kind of interesting, we were discussing that, and then, I said, there is a problem. I said, you treated him. You gave him, compression to put on that. If something happens, they're going to say he got an infection. Somebody could say he got an infection, or why wasn't he treated if he was bleeding? So, and I said, you shouldn't have given him anything. And the guy, of course, disagreed with me. Maybe he was right. I don't know that. There, I don't think so. I think I was still right. But anyway, this guy was so arrogant and so I mentioned sort of the other nurses. And I didn't like, that I didn't like this guy that I had to work with. I was glad it was I think he worked like 2 days a week there, and the other days it was, I'm glad, Virginia, I'm glad you're working tonight. I hate working with that other guy. Why? So then the more I saw of the way he was doing things, I finally told the other nurses. I forget what happened. Something happened, and I think I came in. I think what it was, I came in and there was a thing like once a year at every hospital. There was a thing. If put the number whatever for the RNs, of your current license this year or whatever. Put the thing. Show that you have your RN card or certification or whatever for this year on this list. And I came in and looked at it, and like his name was of course on the list. And then I said, do you guys, who checks to see if this is accurate or not? What do you mean? And I said, I don't believe, let's say his name was Joe, I don't think Joe was an RN. Well, yeah. And of course I knew he was, Well, yeah, he's an RN. Why? And I said, okay, I've been doing this for whatever it was at that point, 20 years, hospital security. And in those 20 years, I have never, ever said anything bad about, a nurse or anybody else. It's not, I'm not qualified to be and shouldn't be talking about, but I can't believe that he is an RN. He is the worst that I've ever seen. He has absolutely no business working in a hospital or working with patients or anything else. And they say, Jim, I can't believe you'd say that. That's not like you to, I've never ever heard you say anything, like that before. And I said, that's the way I feel. And so then it was, I think, a few weeks or, later, because he was only working like a couple of days a week. They said, Jim, well, you'll be happy because so-and-so, he's not going to be working out here anymore. And he's now working at St. Luke's. And they said, St. Luke's is a really good, and that's what I'd heard, myself, that St. Luke's was a really good hospital. And they made sure the people they hired were really good and everything. A lot of people said, if you wanted to go to St. Luke's was a good one to go to if you had a heart, problem especially. And I said, I'm just glad he's gone. And I forget, it was just a few weeks later, a month later or something like that, and I came in, there he was, working again. And so when I saw the other nurses, after he left, the nurses, that was right. The nurses said to me, Jim, you were right. We're glad he's gone, and but but he did go to St. Luke's, and St. Luke's only hires really good people. But we're glad he's gone because we don't like him and didn't feel comfortable working with him or whatever. And I said, well, he's gone. And so I don't know, a few weeks later, I come in and he's working. And then about a week or so later, I come in, and I could just tell when I came in, the nurses looked at me and everything and said, Jim, when the doctor goes to bed and when there was no other, when there was no patient, I want to tell you something. And so then, the ER doctor goes to bed. We didn't have any patients, and they said, no, you can't don't tell anybody about this or anything. It's, and they said, he doesn't work here anymore. The morning before, at the end of the shift for the midnight, shift nursing and everything in the emergency room, they had several patients, and one of the patients was an elderly white lady, somebody's grandmother, was seen, no major problem, needed a injection of something, and the nurse, I'm not going to use her real name, let's call her Mary. So this one nurse, Mary, she said, she was my patient, and it was time to go home, and I wanted to finish up, doing do the paperwork and give her shot or whatever. And she said, but this nurse, I think she had 7 kids, a born again Christian or whatever lady, the nurse, and she said, I just had a feeling that I should stay, but I needed to get home. So, which is not unusual. They were doing that stuff on the floor. Time to go home, okay, here's, like on the floor, it'd be like, okay, the RN or whatever, the other RN coming on, and okay, here's the patient, Mr. Jones, okay, he's in such and such, and this is what, and he's had such, and they do, I forget what do they call that? Report. Oh, they did. Nurses hated when they were doing the report, passing on the information to the next, shift. They hated to be disturbed for any reason, So, anyway, she said, but I needed to get home. So she said, did I say his name was Joe? Or that, anyway, yeah, Joe, I think I did. Anyway, this guy that I didn't like, and that I said was incompetent, he took over. And he gave the lady who was getting ready to go home the injection that he was supposed to, the shot that he was supposed to give her. I can't imagine what shot it would be. Anyway. Can't imagine what shot it would be. Running through my mind, not a tetanus shot. Not going to, no matter how much you gave somebody, probably. You probably couldn't kill him up anyway. And I don't remember the exact scenario, the exact numbers or whatever, but I'm guessing that he was supposed to give her, let's say, an injection of 0.01. But he gave her, I'm thinking, an injection of 0.1. What's the difference between that? 100%. The patient died right away. Now, in case you're wondering, by the way, the hospital, I don't know why, but this was not covered up. I mean, the hospital, but they didn't want, of course, anybody talking about it and that type of stuff, but it was not covered up. My ex-wife, she thinks that hospitals cover everything up. She thinks that there's all time, you know, she doesn't. And I've tried to, but she doesn't listen to me. I mean, she doesn't say, fuck you, I don't want to listen to you. She listens, but it just does not register. And she, you know, I explained to her when, you know, somebody does an operation or some procedure and something happens and somebody dies, or even if they don't die, there, you know, there is the people get together, medical people, the patients, you know, the patient's doctor, the doctor who did the surgery, the doctor, the anesthesiologist, and, you know, these people, and they review all of these cases. You know, all these things are reviewed, and a medication error is that's a big thing. That's things hospitals don't want, and that's why when you go in the hospital and maybe you're hurting and you're sick, you know, and you're there, and you know, the nurse says, you know, Mr. Jones, and you say yes, and the nurse says, what's your date of birth, and you tell her, and then the nurse looks at the armband. Maybe somebody else looks at the armband. I mean, it just, you know, you're kind of like, oh, I'm hurting, help me, but there's a reason for all that. And then sometimes the system does, you know, sometimes the system fails. Anyway, I'll put a link to this thing. I'll also put a link to this. You might, okay, I gotta switch cameras again here. There it is. There it is, fuzzy. Need your eyes tested? There it is. You know, with this too, if you're old like I am, you could maybe get somebody, maybe, you know, maybe somebody who's not old could put the medications in there for, you know, for you. So where are we? Today is the last day of the month. No, it's not. Wait a minute. Okay, that's what confused me. Yeah, I'm talking about today, because I take these little naps. So I came over here and the 29th was here. Alexa, what's the date?
It's Wednesday, June 30th.
Oh, okay. Huh. Oh, I see it says June 30th up here. Down here's the problem. Microsoft, your Windows, what is this? Whatever it is. Your Windows sucks. Yeah, well, no, okay. Yeah, okay, I did. The 29th, yesterday I forgot to take my medicines. The 29th was here, and it was, the morning medication and the night medication was in there. You know, you could set, I shouldn't say the word Alexa, some of you might use the word, you know, the word for the Amazon system, the Echo word, or the Alexa word, or whatever you could, So I did miss taking my entire medications for yesterday. Okay, I think that's it. I don't know if my grown son has told his mother about the medication here or not. And I'm going to go in, and I kind of thought we might be picking her up, because she freaks out about a lot of stuff. And anyway, I'll put a link to the medications error thing. Oh, you don't see that? Okay. I'll put a link to it, and I'll put a link to this in case you want to buy it. And you might let me know. Like I said, when I started out, I filled them all. And of course, it was just once a month I had to do that, but it was a pain in the butt. And then I started just doing like 8 days at a time, but then it seemed like I was filling it all the time. And so I've gone back now to filling the entire thing at one time. Anyway, thank you very much for watching.